Epistaxis is the medical term for a nosebleed. A nosebleed, meaning a loss of blood from the tissue that lines the inside of your nose, can occur in one or both nostrils. Usually it only affects one nostril. Your nose has many tiny blood vessels in it. These vessels help warm and moisten the air you breathe, but they lie close to the inner surface of your nose. When air moves through your nose, it can dry and irritate your blood vessels. This makes them very easy to injure or break, causing a nosebleed. Who get epistaxis? Children between ages 2 and 10. Dry air, colds, allergies, and sticking fingers and objects into their noses make children more prone to nosebleeds. Adults between ages of 45 and 80. Blood may take longer to clot in midlife and in older adults. Pregnant people. Blood vessels in your nose expand while you're pregnant, which puts more pressure on the delicate blood vessels in the lining of LLP nose. People taking blood-thinning medicines. These drugs include aspirin and warfarin. People who have blood clotting disorders. These include hemophilia and von Willebrand disease. Types: anterior nosebleed. An anterior nosebleed starts in the front of your nose on the lower part of the wall that separates the two sides of your nose. Capillaries and small blood vessels in this front area of your nose are fragile and can easily break and bleed. This is the most common type of epistaxis and usually is not serious. These nosebleeds are more common in children. You can usually treat these nosebleeds at home. Posterior nosebleed. A posterior nosebleed occurs deep inside your nose. A bleed in larger blood vessels in the back part of your nose near your throat causes this type. It can result in heavy bleeding, which may flow down the back of your throat. You may need medical attention right away for this type of nosebleed. This type is more common in adults. Symptoms. Most often you would not have any symptoms other than blood coming from your nose. If you have a posterior nosebleed, some blood may drain down the back of your throat into your stomach. This can cause a bad taste in the back of your throat and make you feel nauseated. If you have additional symptoms, it may be a sign of a medical condition. Causes. The most common cause of nosebleeds is dry air. Hot, low humidity climates or heated indoor air cause dry air. Both environments cause your nasal membrane to dry out and become crusty or cracked. This makes it more likely to bleed when rubbed or picked or when blowing your nose. You may also experience epistaxis after inserting an object in your nose or injuring your nose and/or face. Other nosebleed causes are infections, colds and sinusitis, especially episodes that cause repeated sneezing, coughing, and nose blowing. Allergies. Allergic and non-allergic rhinitis can cause nose to bleed. Blood-thinning medications. Drugs such as aspirin, non-steroidal anti-inflammatory drugs, warfarin, and others may be the cause of epistaxis. Recreational drugs. Cocaine and other drugs you inhale through your nose can irritate the lining. Chemical irritants. Chemicals in cleaning supplies, chemical fumes at workplaces, and other strong odors are also the cause. High altitudes. The air becomes thinner and drier as the altitude increases. Deviated septum. An abnormal shape of the wall that separates the two sides of your nose. Nasal sprays. Frequent use of nasal sprays and medications to treat an itchy, stuffy, or runny nose. These medications, antihistamines, and decongestants can dry out your nasal membranes. Other less common causes of nosebleeds are alcohol use, bleeding disorders such as hemophilia or von Willebrand disease, high blood pressure, atherosclerosis, facial and nasal surgery, nasal tumors, nasal polyps, immune thrombocytopenia, leukemia, hereditary hemorrhagic telangiectasia, pregnancy. How to stop a nosebleed. Sit upright and lean your body and your head slightly forward. This will keep the blood from running down your throat, which can cause nausea, vomiting, and diarrhea. Breathe through your mouth. Use a tissue or damp washcloth to catch the blood. Use your thumb and index finger to pinch together the soft part of your nose. Make sure to pinch the soft part of the nose against the hard bony ridge that forms the bridge of your nose. Squeezing at or above the bony part of your nose won't put pressure where it can help stop the bleeding. Keep pinching your nose continuously for at least 5 minutes before checking if the bleeding has stopped. If your nose is still bleeding, continue squeezing your nose for another 10 minutes. If you would like, apply an ice pack to the bridge of your nose to further help narrow blood vessels and provide comfort. After the bleeding stops, don't bend over, strain, and slash or lift anything heavy. Do not blow or rub your nose for several days. Risk factors. You get epistaxis often. You have symptoms of anemia. You have a child under age 2 who has had a nosebleed. You're taking blood thinning medications such as aspirin or warfarin, or have a blood clotting disorder and the bleeding won't stop. You get a nosebleed that seems to have occurred with the start of a new medication. You get epistaxis as well as notice unusual bruising all over your body. This combination may indicate a more serious condition such as a blood clotting disorder, leukemia, or a nasal tumor. Treatment. Nosebleed treatment depends on the cause of the bleeding. Epistaxis treatment may include nasal packing. Your healthcare provider will insert gauze, special nasal sponges, or foam, or an inflatable latex balloon into your nose to create pressure at the site of the bleed. Your provider may want to leave the material in place for 24 to 48 hours before removing it. Cauterization. This procedure involves applying a chemical substance or heat energy to seal the bleeding blood vessel. Your provider will spray a local anesthetic in your nostril first to numb the inside of your nose. Medication adjustments. Reducing or stopping the amount of blood-thinning medications can be helpful. In addition, medications for controlling blood pressure may be necessary. Foreign body removal. If the cause of the nosebleed is a foreign object, your provider will remove it. Surgery. Surgical repair of a broken nose or correction of a deviated septum if this is the cause of the nosebleed. Ligation. In this procedure, your provider will tie off the culprit blood vessel to stop the bleeding. Preventive measures. Use a saline nasal spray or saline nose drops 2 to 3 times a day in each nostril to keep your nasal passages moist. You can purchase these products over the counter or you can make them at home. To make the saline solution at home, mix 1 teaspoon of salt into 1 quart of tap water. Boil water for 20 minutes and let cool until lukewarm. Add a humidifier to your furnace or run a humidifier in your bedroom at night to add moisture to the air. Spread water-soluble nasal gels or ointments in your nostrils with a cotton swab. Bacitracin, Vaseline, or air gel are examples of over-the-counter ointments you can use. Be sure not to insert the swab more than 1/4 inch into your nose. You can purchase these gels and ointments in most pharmacies. Avoid blowing your nose too forcefully. Sneeze through an open mouth. Always sneeze into a tissue or your elbow. Avoid putting anything solid into your nose, including your fingers. Limit your use of medications that can increase bleeding, such as aspirin and ibuprofen. Remember that any medication adjustment, especially prescribed medication such as warfarin and nonsteroidal anti-inflammatory drugs, should only be done under your healthcare provider's supervision. See your provider if you cannot easily control your nasal allergy symptoms with over-the-counter or prescription medications. Quit smoking. Smoking dries out your nose and irritates it. Wear protective headgear if involved in activities that could result in an injury to your face and nose. Keep your child's fingernails short.